In South Africa, 1.5 million households are run by grandmothers over the age of 60, with the highest percentage found in the Eastern Cape. These matriarchs can look after as many as 10 grandchildren at a time, while struggling to access healthcare services they desperately need in their old age. Nearly 18 months ago, stories of the Eastern Cape's poor emergency medical services came to light, leading to a provincial hearing.
And on the grants.
Nolibele Deve's story from 2015 captures the impact of inaccessible healthcare services in Qelani village in the Eastern Cape. She travels a 13-hour round trip, including using a boat, to seek treatment for her arthritis. The Department of Health has made a list of recommendations to improve the access to emergency medical services in the Eastern Cape. Yet, a recently published study by the Rural Health Advocacy Project shows that little has changed for healthcare services in the Eastern Cape.
The wheels of change turn slowly. Right? And I think when you look at the official reports, there is some movements, they made bigger investments, there's lots of ambulances on order and so forth. So I think in terms of the optics, yes, the East Cape, the Rural Health Advocacy Project was part of a broader coalition of NGOs called the Eastern Cape Health Crisis Committee that looked at this, and through our advocacy and the work of the Human Rights Commission, the issue was sort of put at the center. Right? So in a way, yes, there's been some improvement, but when you talk to people on the ground, who are actually experiencing this, the situation hasn't changed. So there's a lot of things that we need to do, and I think the only way we can move the discussion forward is by really, one, focusing on these issues, but secondly, also starting a conversation between everybody that's affected and infected and engaged in this issue, to start a conversation that looks at addressing all the barriers, not just the access to a taxi or a clinic. That's just the end point. I think it's about getting people to that journey, to engaging with their health and realizing that an investment in health is an investment in the overall capability of that person to be able to progress along this development chain.